Well, I think as a lung cancer physician, I was really struck by the suffering, both the physical and emotional suffering that patients and their families go through. And I was really feeling like the traditional model of having patients and families cared for exclusively by an oncologist wasn't necessarily meeting all of the needs for patients and families. In addition to the physical and psychological symptom burden associated with having a difficult cancer diagnosis with lung cancer, we know that patients and their families often desire or prefer to have more information about their illness and prognosis. And again, traditionally, they feel that they don't get all of this information from their oncologists. And we know that patients with cancers such as lung cancers face incredibly difficult decisions about their care and decisions about when to stop therapy, and we're not always doing the best job of supporting them as they're navigating those decisions. So I just have a couple of slides to basically show you some data or some evidence supporting some of the statements that I made on the first slide. So just to start with symptoms in patients with advanced lung cancer. So this slide shows how common symptoms are in patients when they have newly diagnosed disease. So you can see at the time of diagnosis, the majority of patients have symptoms like loss of appetite and fatigue, which are incredibly difficult to manage. And then because lung cancer involving the lungs, many patients have cough, chest pain, or shortness of breath. And you might think, well, that's when they're diagnosed, they're going to see their oncologist, they're going to get chemotherapy, and those symptoms are going to get better. And while that does happen sometimes, often even when patients are getting their cancer treatment, even when they're seeing their oncologist every week or every few weeks, they still have lots of symptoms. And you can see those green bars on the slide show us that although the symptoms were a little bit better than the previous slide, the majority of patients do still have symptoms from their cancer. And then unfortunately, when their cancer grows, their symptoms become even more common. So what these two slides tell us is that these patients have a high symptom burden beginning at the time of diagnosis that persists throughout the course of their illness and that intensifies as they become more ill from their disease. So again, you might say, well, why doesn't chemotherapy fix this? Well, there's a couple of reasons for that. And one of the reasons is chemotherapy in patients with advanced cancer has trade-offs and side effects. So if people have cancer-related symptoms such as pain or breathing difficulties or fatigue, and they get chemotherapy and their cancer gets smaller, those cancer-related symptoms may decrease. However, you're sort of trading them off, like on a seesaw, for chemotherapy-related symptoms, which can also cause fatigue and other symptoms such as nausea, nerve pain. In addition, there's all of the elements that go into, for example, quality of life when you have a cancer diagnosis. The psychological and emotional distress, the spiritual distress, how the illness impacts family. So again, while chemotherapy can improve symptoms, sometimes the trade-off is very difficult. And in addition, there's so many other factors that go into living with a cancer diagnosis that just focusing on cancer-directed treatment, such as chemotherapy and radiation, isn't really enough to support our patients and certainly their families. Talking about the psychological or emotional distress, obviously when you're diagnosed with a cancer like lung cancer, many people feel distressed or anxious about the cancer diagnosis. And I think one element that really gets ignored or not addressed sufficiently is that the family members, the husbands and wives and sons and daughters of patients with lung cancer, also feel very distressed and worried when their family member is diagnosed with cancer. And data tells us that the risk of feeling depressed or anxious is highest in the family members taking care of more ill patients. And again, unfortunately, patients with lung cancer tend to be quite ill. Many people are surprised to hear that there's actually physical health risks associated with caregiving. If you're taking care of your husband with metastatic lung cancer, taking him to his chemotherapy visits, making sure all of his medications are in order, you're not going to go get your mammogram or your physical exam. So that sometimes caregivers of patients with lung cancer actually become more ill themselves.